Okay, so um, here we are. Like I said, I am definitely an advocate for the multicultural communities that are impacted by the disparities in the mental health system. And you know, in modern day, mental health in multicultural communities continues to demand a lot of our attention. And over the years, these communities have certainly made progress. So I don't want to shy away from mentioning that. Um, we know that our communities have brought more consciousness to the reality of mental illness, with just an increased openness to having dialogues about it. And you know, you bringing this to your community is also a big part of that. Also, just willingness to seek support. However, there's still a lot of work to do as Black and Brown people continue to be disproportionately and negatively impacted by the misrepresentation in the mental health care system as a whole. So in this presentation, I will talk about these disparities and maybe discover also or go over some solutions on a systems and on an individual level that we can do to begin to see the changes that we want to see. So I'm going to start by going over the prevalence of mental illness in the US. So this is, you know, every time I see this, it just blows my mind. Nearly 1 in 5 US adults live with any mental illness. And when I say any mental illness, that's defined as mental, behavioral, or emotional disorder, ranging in its impact from having no impairments at all to mild, moderate, or even severe impairment. And severe impairment is illness that results in serious functional impairment, and there are 1 in 25 US adults who live with severe impairment. The sad truth is 50% Americans that meet criteria for a diagnosable condition will begin to have these conditions, these symptoms by the age 14, and only half of them actually receive treatment. So the big question is, you know, why is that? So let's take a look at this chart here. On the left, we have the US population that's broken down by race. And on the right, it's the number of Black and Hispanics in the US who had a diagnosable mental illness in the past year. So in the US, there are about 330 million people. And of those, close to 70% are white, 17.8% are estimated to be Latino or Hispanic, and of those, 15% had a diagnosable mental illness. That is over 8.9 million people, which is more than the number of people living in New York City. And wow. The bottom graph, it shows you the representation of Black people. So there are 13.2 of the US population who identify as Black or African American, and of those, 16% had a diagnosable mental illness. Again, that is the population combined of Chicago, Houston, Philadelphia. And I show this pie chart and the infographic to highlight that multicultural groups make up about 1/3 of the US population, yet they continue to have these unmet behavioral and mental health needs by large. So this brings us to the question, why is that? And one answer is systemic and structural barriers. So let's take a look at this data that is collected by the Substance Abuse and Mental Health Services Administration. So what you're looking at here is some of the main barriers that to mental health treatment, which will explain the different reasons why the mental health needs for multicultural groups are not being met. One of them is access to treatment is limited by lack of insurance coverage. Simply, people can't afford insurance or had very little insurance or no health coverage at all. So if you look at this data here, the teal color section, Asians, 48.7% cannot afford it. That's why they're not seeing a therapist. Blacks, 45.4%, Hispanics, 52.6%. And then 2 or more races, 41.7%. This is pretty just a huge barrier. And the second one is structural barriers, which is represented in this column here. And when I say structural barriers, we're talking about inadequate transportation, inconvenience being able to take time off from work, securing childcare, cultural and language barriers, or simply not knowing how to access these services. And that saddens me. It's 2021 and we have a lot of our people unable to know where to go when they need this kind of help. And then there's also low perceived need, meaning multicultural groups often don't feel the need to have these services. They feel like they can handle the problems on their own. And a lot of this has to do with lack of understanding the impact of mental illness. And then we also have prejudice and discrimination. And, with prejudice and discrimination, a lot of that is lack of psychoeducation, this misconception, the myths that are associated with mental illness, and then the discrimination experience on the provider end, including racism, microaggression, which can impact the care and the treatment provided to the client and the experience that the client have. So all of these factors, they eventually lead to these concerns over effectiveness. There are a lot of multicultural individuals who don't think that these services will help them because of all these different barriers that they've experienced one way or another. So there are clear and unfair differences in accessing mental health services for multicultural groups. And I'm going to elaborate on 3 main factors: socioeconomic disparities, stigma, and disparities in the medical system. When I say socioeconomic disparities, we're talking about economic resources which actually impact access to health, educational, and social resources. As you can see in this chart here, socioeconomic status is the biggest determinant to mental wellness. And the disparity is the reality that there are race-based exclusion from these resources, which we have seen throughout history, leading to impoverishment, homelessness, incarceration, and people having substance use problems, which actually puts people at a higher risk for poor mental health. And again, the reality is ethnic minorities living below the poverty line are more than twice to report serious psychological distress than those more financially secure. And also, according to the Health and Human Services Office of Minority Health, Black adults in the US are more likely than white adults to report persistent, meaning ongoing, rather than episodic, symptoms of emotional distress, be it hopelessness, worthlessness, or sadness. And a lot of this has to do with the fact that Blacks or Hispanics, they are in these disadvantaged environments for a very long period of time, which makes coping or overcoming these challenges that much more difficult. In 2019, the median household income for Blacks was a little over 45,000 compared to Hispanics, 56,000, whites, 76,000, and Asians, 98,000. We can see that the gap is clear as day. Oh, sorry, let me go back. This gap is clear as day. And, although as wide as this gap is, believe it or not, the 2 groups, Blacks and Hispanics, actually reached their historic low in their poverty rates. So this is the best they've ever been. And, this just shows us, yes, there is progress, but there's a lot more work to do. I mean, a lot more work to do. And stigma is another barrier. More than 60% of people with mental illness, they don't seek the help that they need, and stigma is the main reason. Studies show stigma usually arises from lack of awareness, lack of education, lack of perception, and just the nature and the complication of mental illness. And what I mean by that is typically people, especially with more of like a serious mental illness, there are these behaviors that are unusual or atypical. But there is higher level of stigma within the multicultural communities. You know, mental illness continues to be this like taboo subject for many people, with implicit prohibition of mental illness. And you know, it's unacceptable, it's a stereotype, and there is this cultural perception that says your inability to overcome your mental or emotional challenges, be it depression, anxiety, or any other mental condition, it's a sign of moral or spiritual weakness, which results in shame, you know, reinforcing people to hide their struggles. And a lot of our people are struggling in silence. And some of this is reinforced by this generational historic misconception where, you know, people really minimize and undermine the impact of mental health issues. This idea, you know, people with mental illness are just stressed out, or you're just tired, or you need to suck it up and push through. You know, we do that a lot, but all of this, it's not helping us. So men are in particular concerned about stigma. So in general, beliefs related to stigma that multicultural communities have, the lack of, you know, openness to accepting mental illness as a health matter, and also the reluctance to seek help, it's a huge barrier that we have to continue to shed light on, and we have to continue to fight against. And last but certainly not least is the disparities in the medical system. This is, I mean, all of these are critical issues that multicultural communities face. Black and brown persons have less access to mental health services and treatment than white people do, which is reflected in this chart that you see here. And they're also there's less consistency in their therapy. Some of them are likely to drop out of therapy, terminate prematurely. They are less represented in research, and they're more likely to receive poor quality care when they are treated, for a few reasons I think worth mentioning. And that is, again, we've already talked about having low rates of health insurance, which results in having inequality to accessing good providers. And there's also discrimination by professionals, you know, and this is a problem of cultural competency. And when I say cultural competency, we're talking about relatability, simply understanding multicultural groups, whether you're Black, whether you're Hispanic, have very different experience in the US. And we have to bring consciousness to these realities, because lacking this cultural competency can definitely result in misdiagnosis, inadequate treatment. You know, there is this study where irritability in white children is associated with depression, where in Black and Hispanics, it's associated with disruptive behavior. And this just blows my mind all the time, because it correlates greatly to the disproportionate representation of racially ethnic minorities in the criminal justice system. Data shows 50 to 75% youth in the juvenile system, they actually meet mental health disorder criteria. But the reality is, when racially ethnic minorities misbehave and they have these behavioral issues, they are typically referred to the justice system rather than some kind of like specialty primary care compared to whites do. And all of these issues, the culturally insensitivity, the biases, the racism, the language barrier, issues surrounding accurate diagnosis, they lead to mistrust. With a lot of, you know, minorities, they don't trust to go to a therapist, especially like when you think about Black people having been historically negatively affected by prejudice and discrimination in the healthcare system. If clinicians fail to bring consciousness to these historical factors, we can really do some damage. We can widen that trust between care providers, the medical health system, and the Black and the brown communities. And again, I don't want to shy away from also saying, over the years, we have seen efforts to improve the disparities both on the systems and on the individual level. And I want to talk about some of those efforts, some policy efforts, that we as a community should focus on improving, is access and, equality to mental health care provided to multicultural groups, which include making sure that cultural sensitivity training is provided for professionals, increasing language appropriate treatment, as that is such a huge barrier, and also providing educational material to the communities that are overwhelmed by barriers. We, the people, like you and I, we need to put pressure on our representatives, policymakers, to implement these necessary changes. We want to see universal mental health care coverage being one of those changes in the near future. Other systems improvement that we want to see is just federal commitment to advocacy, outreach, and educational programs to be accessible, especially to the multicultural communities, economic incentives, and increasing, the proportion of multicultural providers, because at the end of the day, we know that diversity can make a difference in addressing the concerns about relatability, about trust, as well as it can help us resolve these language related barriers. So on an individual level, so this is where you and I step in, everyone that's watching this presentation, and I, there are things that we can do to level out these disparities, and that is to continue to fight the stigma, against the stigma. Although there have been, again, progress in recent years, there's still higher level of stigma associated within the multicultural communities. So we need to educate ourselves, educate our families, our friends, our colleagues about the unique challenges of mental illness within the Black and the brown communities. An African American living with mental illness is also experiencing trauma as a result of living in a systemic racist or racism kind of society. The same can be said about Hispanics and other multicultural groups. We need to increase our own attitude and beliefs and bias assumptions about mental illness. When we bring awareness to that, we're also bringing awareness to the stigmatizing language that we use around mental illness. We say stuff like, oh, he's crazy, or she's gone mad, or they're violent. These are stigmatizing languages, and we need to be aware of that. If you're receiving treatment, you need to demand more from your care providers. Hold them accountable, because they need to know how to look beyond their cultural scope of understanding an individual. There are about, I think I read somewhere, I could be wrong, where this data could have changed, but 4% multicultural providers that with us that are psychologists. So, because that's not available, we need to be able to demand what we need from our providers. Advocate for yourself. You are the expert at being you. You know your symptoms, you know how you feel. And if something isn't right, have the courage to share that with your provider. At the end of the day, clinicians, and I speak for myself also, we're human and we have blind sides. So if you feel, this doesn't seem right, or I don't know if this diagnosis fits me, feel free to bring that up. Last but certainly not least, prioritize your mental health, because it matters. When you get your mind right, your life follows. That's like one of my favorite things to say. At the end of the day, we all have to accept that mental illness is a health matter. It's not a sign of weakness. It's not a matter of going mad or being spiritually defected or unmotivated. It is a chemical imbalance. It's a brain disorder influenced by our biology, social and environmental factors, and our psychological state. Just as we wouldn't write off having a heart condition, cancer, or diabetes, let's care for our mental wellness in the same manner. Especially today, more than ever, we stand in a very vulnerable position. There is an elevated level of adverse mental health condition that is really spiked during the pandemic. Anxiety has been reported uh, 3 times higher, depression 4 times higher, substance use, suicidal ideation. The other day I saw on the news deaths that are related to overdose, over 81,000. I could not believe it, you know? And these mental health conditions are unfortunately disproportionately impacting the multicultural communities, especially Blacks and Hispanics. I mean, there are other special groups also, like essential workers and those that receive pre-existing psychiatric treatments that are impacted by the pandemic. So we need to advocate and care for our mental wellness today, like now more than ever. Although there are systems and structural changes that we need to see and that need to be made, just know that change always begins first with the individual. So let's focus on what we can do individually to improve our mental wellness. And some things are starting very basic, and that is getting good sleep. You know, a lot of the times we are very good at starting our day. How do I wind up? We need to wind down. You know, you can do things to make sure you're getting a good night rest, like taking a hot shower, because your body is going to regulate itself automatically. So your rest state is going to kick in. Staying away from your computer, your phone, your screen, because that screen and that blue light exposure, it blocks the release of melatonin, and you need melatonin to have a good night rest. So you can do little things like that. You can start by adjusting your eating habit, eat right, exercise, go out for a walk, be in nature. Whatever is, your body and your mind asking you, listen to it and give it that. Take good care of your physical and emotional needs. Stay connected in a very safe manner, but stay connected socially, because we're social beings and we thrive in connection. The pandemic hurt us badly because we're doing something out of our nature to be disconnected from these interactions that we have. Is so it's hard on us. So try to stay connected with people, and then stop to assess how things are going with you. We don't ever do that. Take 10 minutes, 15 minutes every day for just a moment to pause and do mindfulness check-in with yourself. We know this mindfulness meditation is scientifically proven to really rewire the brain, the negative wired brain to positive wired brain. So check in with yourself, and whatever you do, be nice and be kind to yourself, be compassionate to yourself. No matter what you're going through, you have to show up for yourself, and this is how you begin to manage your stressors, every day. So the last thing I want to say is I want to close by one of my favorite quotes, and that is, there is no magic pill to leading a mentally fit life, but there is a method to what may look like magic, and that is to starting in these basic places of beginning to sleep right, eat right, and show up for yourself. So thank you.
Wow, thank you so much. Great presentation.